resources for those children who become COVID positive or are obviously isolated due to being a close contact and need to do their study from home. I really want to congratulate the South Australian Education Department and all of our dedicated teachers who have developed an incredible array of fantastic facilities, videos. I've just done the health hustle. Well, actually, I didn't do the health hustle, I just observed the health hustle. I was invited to participate, but some of those moves did look a little bit complicated. It was fantastic to see the quality of these lessons, which will be available for people who cannot come into school due to being isolated or being COVID positive. Today we also announced that we will be setting up an ICT hotline because we know that a lot of people will be learning from home. Some of them will have some IT challenges, and so we want to support them as much as we can. So our Learning SA website is now up and running. It will be set up for school when we return to classes as of Wednesday this week. Obviously, we already have some students going back into the school today. The children of essential workers and those that come from a more vulnerable community, our schools are open for them as of today. Classes start on Wednesday, and as we know, preschools receptions 1s and 7s, 8s and 12s will be face-to-face from Wednesday this week. The remaining students will be learning from home with their teachers and with their class. But the resources today are specifically focused on those people who need to be isolated from their class. And so this is a fantastic body of work that's been done. To tell us a little bit more about this now, I'm going to ask the Minister for Education in South Australia, the Honourable John Gardner, to tell us about that. Then I'll come back, answer any questions and also give you the update in terms of the COVID numbers for today. John.
Well, thank you very much, Premier, and everything the Premier has said is obviously accurate, and we're really proud of the work that's been done by the Department for Education to prepare these Our Learning SA resources. These resources are available for students from reception to Year 10. They're not designed to replace the lessons that are in the classroom. So for those students who are learning face-to-face, that's fantastic, and for those students in Years 2 to 6 and 9 to 11 who will be learning their online program with their classes, they'll be doing their classes that their classroom teacher is preparing. But we do know that there are going to be a number of children who are right now or will be in the coming weeks who are COVID positive or are indeed close household contacts, for example, and have to isolate at home. And we also know that it's not practical for classroom teachers to prepare two methods of delivery, both for those in the classroom, those in the class, and also for those who are having to do learning at home. That's not a reasonable expectation of those classroom teachers. So these materials, and we're talking about dozens and dozens already prepared for week 1, ultimately there'll be hundreds of videos and PowerPoint lesson presentations. These are to provide confidence and reassurance for families, for students, and indeed for those classroom teachers that the learning needs of those students who are isolating at home will absolutely be met. They're high quality materials and resources prepared by world-class Department for Education teachers, and indeed for years reception to 10, they're actually ready to go now for the week 1 lessons. Lessons in literacy, numeracy, HASS, which is history and social sciences, and physical education in the primary years, and in the secondary years we're talking about English, maths, science, and again health and physical education. And they're available for all to see. Indeed, if you're on the Department for Education's YouTube channel or the Our Learning SA website, you can access those now. Students will be encouraged to listen to instructions from their teachers about the order and so forth to use them. Certainly I think that many adults, many parents will be really impressed by the quality of the materials. Some may choose even to participate in some of the health and physical education lessons themselves. We're also restarting today the parent hotline. We're also restarting today the parent hotline for those parents of children who are learning from home who have ICT issues. This was a really popular resource for families facing those ICT issues in other stages of the pandemic, and those experts, those IT experts who are familiar with working in education settings and familiar with the resources that parents will need to know about will be available for parents who need that support. That hotline's been reopened as of today.
So just to clarify, it's just those isolated, it's not those So they've got online classes with their teachers, is that right?
So the resources will be publicly available and available for anyone who needs them, any family who wants to access them. They're available for teachers who want to use them to supplement their own work. But to be clear, for those children who are learning face-to-face, it might be an example where a child contracts COVID and has to be isolating at home, or a child who is a close contact and so has to be isolating at home, removed from their classroom. It'll certainly be useful for children in those circumstances. They're available for anybody who needs them to keep that continuity of learning. They're available to supplement other classroom programs where the teacher sees they'll have value.
Is this something that the department itself has created, or is it something that's been brought in or contracted out?
No, we're really proud of the work that's been done by South Australian teachers from the South Australian Department for Education. We've recorded the video lessons through the Department for Education. They are South Australian teachers in a South Australian context, teaching the national curriculum, ensuring that given the circumstances that we are facing this year, that continuity of learning won't be impacted. All of them have been developed this year.
When was this work prepared?
We've been preparing this work over the last couple of weeks, and indeed the first week, and a bit more than the first couple of weeks indeed, is ready to go now, but obviously we'll be releasing them week by week. Over the first 4 weeks we're planning on having those dozens, actually hundreds of lessons prepared, given that each year level will have those special bespoke lessons for each day, and indeed we'll reassess as we approach the end of week 4 to determine what adjustments are needed and what extra resources or what other resources are needed going forward after the end of week 4.
So this is for those year levels who should be at school?
We've prepared them for all year levels from reception to year 10, but we particularly expect that in the first 2 weeks the receptions and year 1s, the year 7s and 8s would be the primary users, but we're familiar that there will be children in other circumstances, especially where the classroom teacher may well see some benefit in using these resources to supplement the work that they're doing directly from the school.
But parents should take advice from the teacher, so if it's a year level that is already online learning, they should be using the school's online learning, not this model?
Well, participating in an online class, you're working with the teacher, so absolutely, and these resources are available to supplement that work if the teacher wants to use them in that way. They're available for anyone to have a look at. They're high quality resources and we think they'll be very welcomed.
Do you have any early information?
Sorry, I'll just let them question.
Do you have any early information on how many students have actually attended school today, children of essential workers and such?
I don't have any data for you now. We can track some down later on. I saw Andrea at Walkerville Primary School earlier today, and I imagine that'll be reflective of many schools, but it will vary from site to site. We would expect there to be more children in primary years that would need to have that provision. Certainly we understand that there are a number of essential workers in our community who were banking on schools going back today, so we felt it was important to provide that supervision opportunity for them, but I've been very impressed by the way that parents have responded to the request to only use that supervision if it is obviously necessary. Classes begin on Wednesday, the first day of school in South Australia for learning is on Wednesday, and we expect that that will be a different circumstance to what we're seeing today and tomorrow.
Minister, in addition to the ICT hotline, previously there was some availability of dongles and laptops for families that couldn't afford them or didn't have good NBN access and so on. Has that been provided to the families already? Or they...
Yeah, absolutely, and indeed we know that devices are a critical tool for learning in the 21st century, and especially over the last 2 years, the way in which we use devices has really ramped up exponentially. Our schools have had over the last 2 years policies in place to ensure that those families and children who needed a device to be able to access learning were able to access those. Many of those were school devices, and where we've had a situation in 2020 and 2021 where a family has not been able to get a device from the school in the public schooling setting, then we've had a central provision of devices through the schools to those families. That continues again this year. There have been hundreds of devices, and indeed for those households where there's no internet availability, it could be a wireless solution, a dongle, or whatever the situation that is relevant is, and we've been able to provide that support. A number of those families will be picking up devices today and tomorrow. Some have already done so.
Is there a number of, we've spoken to other childcare centres today who would expect to start surveillance testing this morning?
Yeah.
They've had no contact from the Education Department, but they've no rapid tests arrive. What's going on?
Look, my understanding is that indeed hundreds of our early learning centres have had the deliveries last week, but I do understand that a number of particularly non-government childcare centres who were expecting those deliveries late last week will instead be getting those deliveries today or potentially tomorrow in some of those regional settings. I, like they, would have absolutely loved those RAT devices to have been provided last week, as was our intention, and I'm very sorry that that didn't take place, but I am very pleased that they'll be getting those RAT tests today or tomorrow.
What about metropolitan sites? So these aren't regional sites that I've spoken to today. What's caused the delay?
Look, obviously it's a very significant logistical challenge. We'd hoped to have those RAT tests available in all of those sites by the end of last week, and my understanding is that those metropolitan sites will be receiving those RAT tests today, and indeed some of the regional sites will be getting them tomorrow. Hundreds of sites have received them, but particularly in the non-government sector, we understand there's been a delay in some of the logistical process from late last week to instead getting them today. I'm pleased that they're going to be getting them today and tomorrow. It would have been better if they'd had them last week, certainly, and I'm sorry that obviously that logistical hiccup has happened, but I am very confident that the process outlined by Professor Spurrier, that will see those RAT surveillance tests in early education settings 3 times a week, will be able to progress from Wednesday morning in those sites that didn't get them last week.
What about schools where people are going to have to do tests to stay? Have all the schools that need them got tests as well?
Yeah, look, my understanding is that the schools have either received them. Obviously, we've got a couple of specific issues in remote areas where there's been impacts from the floods that have got their own sets of circumstances, but the distribution to schools of a 3-week supply, which is also the same length of supply that we're distributing to childcare centres, depending on obviously the regime, but a 3-week supply of what the schools are expected to potentially need has been provided or is being provided ahead of Wednesday, and indeed there will be further deliveries capable of being done before the end of week 3. So if a school has a circumstance where they have to use some of those RATs to stay, which is of course a 7-day regime for teachers who are classroom contacts, then we'll be in a very strong position to ensure that they have more if they need them prior to the end of week 3.
We've heard less than half of Catholic schools have got their rapid antigen test supply and masks. School started today. Why were you ready?
Well, school starts on Wednesday. We have a supervision opportunity for sites to provide that supervision from today, and indeed the expectation is that all of those schools will have their supply of rapid antigen tests ahead of school beginning on Wednesday. The procurement of masks by Catholic Education is a matter for them. There hasn't been any weakness in the supply chain for masks up to now. Indeed, the Department for Education sites, my understanding is that they've got those masks in place, and previously through the pandemic, where the non-government sectors have had an urgent supply chain issue, then we've been able to assist through government processes. But in terms of masks, that would be a matter for Catholic Education.
Can you give us an update on the air quality audits? I think as of a couple of weeks ago, only about 50% had been done, and whether that's been completed and whether the work has actually taken place there?
Yeah, so there's 2 issues here. The first is the audit, which was a desktop audit that was undertaken last year. I think I've reported on that a number of occasions since November. And that identified that a really good number of our classrooms had access to high quality air conditioning with fresh air intakes, and an overwhelming majority of our classrooms were capable of opening their doors and windows such as was necessary. What's happened since then is a survey, or an audit if you like, in individual classrooms where principals and school leaders and site leaders have been identifying where there are particular works orders that needed to be undertaken, and indeed those works orders have been either assigned to maintenance staff at the school if there is an appropriate staff member, or indeed to relevant facilities managers to undertake as those have been coming in. I'm very confident that there will be a very high level of those upgrades, improvements, whether it's carpentry or air conditioning upgrades, whatever it is, will have been done in time for the beginning of school. But indeed, we have procured, as was reported last week, an extra 3,000 air purifiers, taking our total to 4,000, so that where we have a site where there is a particular concern and people think there is a benefit in providing that extra use of air purification, then we'll have those distributed ahead of the, during this week.
So where are those 4,000 air purifiers going?
Well, we obviously identified a couple of weeks ago that in Port Pirie, where there's a local environmental circumstance that is of a pretty similar nature to the purpose for which we bought the air purifiers in the beginning, that being air quality impacted by local environmental circumstances, for example bushfire, those were delivered to Port Pirie, I think in the order of 70 or so of the air purifiers for use in sites where they don't have the particular fresh air intake air conditioning. Some sites have some classrooms that have that modern air conditioning, some of the sites have none, but the difference in Port Pirie is that we're asking our sites to keep their windows closed, and indeed the remainder of the units are being distributed throughout the state. Obviously a school like Adelaide Botanical, one of the schools that's opening this week, all of their air conditioners are top-notch modern air conditioners, so they don't have the same need that some of our older sites might potentially have, and so they'll be distributed to every corner of South Australia.
So how did you know to buy 3,000 then? Was it already worked out where the need was?
Well, we had an understanding, certainly from our audit last year, of a high number of our classrooms that had access to fresh air intake air conditioning, so they wouldn't need one, and indeed an overwhelming majority of the remainder who are able to open doors and windows suitably. So we have a body of 4,000 air purifiers, and we're distributing them across South Australia for use in those sites, in those areas of those sites where there is seen to be a high level of need. We have the capacity, because we have probably more than is absolutely necessary, certainly in terms of the health advice, we have many more than has been identified as necessary. We have the capacity to put more in those sites that have the greater level of perceived need.
Do you know how many teachers got COVID on day one? Are you maintaining
I don't have that information. I'm sure we can track it down for you. And the Premier's got obviously more information about COVID. Thanks.
Thanks very much, Minister. So I'll now present the information, the COVID information for South Australia, and I've got to begin by sadly acknowledging the passing of 6 South Australians reported over the last 24 hours. That takes our total in this state since the pandemic began back in early 2020 to 117. Yesterday we had 1,505 positive cases that were reported in the 24 hours to midnight last night. 1,113 came from a PCR test and 392 from a RAT test positive. Yesterday we also recorded 2,227 recoveries, so significantly above the number of new infections. Our 7-day average now of positive cases is just down below 1,850, so a massive fall of where we were 2 or 3 weeks ago. We currently have 19,847 active cases, so we've broken through that 20,000 active cases barrier, going in the right direction this time. We have 281 people in hospital, so again a slight reduction on where we have been. 25 in ICU and 4 people on ventilators, and certainly over the last week or so they are better numbers for us than what we've experienced in terms of ICU and ventilators. Yesterday was a reasonable day in terms of testing. It's often very low on a Sunday, but we did have 8,880 PCR tests administered with 2,092 RAT test kits which were picked up. We also had a low vaccination rate yesterday, 6,472. Again, that's commensurate with the Sunday numbers being the lowest for the entire week, and I'll come back to that in a moment. But my final piece of advice to you today is that we have just 371 SA Health staff right across metropolitan Adelaide who are now furloughed, and 241 of those are COVID positive. So the lowest numbers that we've seen for a very, very long period of time. So those numbers who are furloughed within SA Health massively diminishing, and that really helps us in terms of our overall capacity planning. Our key issues at the moment are vaccinations. I'm very pleased to report that South Australia has the highest booster rate of any state in the country, but I'm not satisfied. When I look at those figures yesterday and when I look at the available appointments this week, it's very clear to me that there are just so many opportunities for South Australians now to go along and have that booster shot. We might be top in terms of Australia, but we're still well short of the total number in South Australia who could have had that booster shot. Now we know that those people who were not fully vaccinated, so at least have had their first 2 shots, plus their booster if it's eligible. We know that those people that are not fully vaccinated are massively overrepresented in our ICU statistics. And so my strong plea to the people of South Australia is to go and have that booster when you are eligible. There are plenty of appointments available. Now, I'm also pleased to let you know that South Australia still has a very high rate of vaccination for those 5 to 11. I caught up earlier today with Samuel and Lucy. They both had their shots. They said it didn't hurt a bit. I don't know about you guys, but when I was younger, the needles were a lot bigger than they are now, and they did hurt. But I've been reliably informed by both Samuel and Lucy, didn't hurt a bit, tiny sting for less than a second. They are now vaccinated, and we really want to get as many 5 to 11-year-olds vaccinated as we possibly can at the moment. There is now no excuse. There are appointments today. You can go down to Wavell, you can have that vaccination, 5 to 11-year-olds. I think we've slipped to number 3 in the country. Victoria, which we edged in front of last week, they're back in front of us again today. So there's the challenge to South Australia. We want to get in front of Victoria, ultimately get to the top of the tree, knock Tasmania off and get as many of our 5 to 11-year-olds vaccinated as we possibly can. The CRC today went for quite a long time. It was our second focused workshop on Aboriginal and vulnerable communities. We now have more than 1,000 members of the Aboriginal community in South Australia who are COVID positive. The vast majority of those people are living from home. I think we have 29 people who are currently in hospital and 3 who are in ICU. So we are seeing those numbers increase. There's been a massive response, particularly since our first workshop in these areas. We're learning more and more about the most appropriate way to respond to this particular vulnerable community. I really want to thank everybody in SA Health who is doing a marvellous job, and in particular Carlin, who are sending quite a lot of support staff into regional South Australia. The vaccination rates amongst our Indigenous communities, especially those in very remote parts of the state, are actually very good. But at the moment we are not seeing that same uptake here in metropolitan Adelaide. Strong message to all Aboriginal South Australians is it's really important to have both of your vaccination shots and your booster when it's eligible, and we're certainly putting a lot of support into that area. We also held an out-of-session meeting of the Emergency Management Council this morning, which I chaired, to look at the extreme rain and flooding events, major emergency declaration which has been in place since Thursday last week. We are absolutely delighted that those RAF planes headed off to Coober Pedy today to drop those emergency supplies there. There is likely to be further opportunities like this in the coming days. It's a real collective effort to support those people that have been cut off by these incredible floods. The Bureau of Meteorology tell me that we're still very likely to have some extreme rain events over the coming 48, 72 hours in South Australia. Many parts of the northern pastoral areas in South Australia are going to have rain events of between 50 and 100 mils every day for the next couple of days. This is going to put extreme pressure on the tenuous situation that we already have. I reported to you yesterday, of course, that the Stewart Highway is cut off immediately above Glendambo. I was very disappointed to learn today that there are still people that think they know better than the police and our emergency services and are trying to get through that floodwaters in the middle of the night. This is causing havoc and it's diverting our emergency services away to save people that should never have got themselves into this situation in the first place. My strong message to all South Australians is to cut out any unnecessary travel into the north of our state at the moment, and for those people who are in the affected flood areas, stay put, don't move around. Some people say, well, I know a way to get there without using the Stewart Highway. Then we've got to effect a rescue in a road that's off the Stewart Highway. It is a perilous situation at the moment. This additional rain is creating havoc. My hope is that later in the week those rain events will cease. We now have more than 18 breaks in the rail corridors in South Australia. There are no trains going north and there are no trains going west. The ARTC are doing everything they can to identify all those breaks and set about repairing them, but it's very unlikely that we're going to have resumed services until the middle of February. In fact, the date that we received this morning had been pushed out further to the 18th of February. So at the moment, we're focused on doing everything we can to get our roads back to being safely, put into a safe order, and of course making sure that we can deal with some of the food security issues which are presenting themselves at the moment.
Premier, childcare is obviously a setting you're very concerned about. You've introduced surveillance testing. Is it good enough that a number of centres had no rapid tests and had no word from the government?
Look, it's a
educators had to go this morning to try and buy some at a pharmacy or Costco.
Yeah, look, the reality is this is a major logistical exercise right across the country at the moment. I think South Australia's done particularly well, but there were a small number of schools and preschools today that didn't have their rats. We'll rectify that in the next 24, 48 hours.
Those that bought them themselves, will they get a refund?
Look, the reality is we're going to get those rats to people as quickly as possible. Most of those centres are not run by the state government, they're private organisations. The federal government reached out to the states and the territories saying that we don't have the logistics to get them there. We've lent in. It's in addition to what we normally need to do, but we're happy to help in this circumstance.
It is you who put these rules in place for childcare, though.
Yeah, look, absolutely, and we obviously worked within the National Cabinet agreed guidelines, probably stuck to it more than most other states, as it turned out. But the reality is these are not under the control of the state government. They're a national part of the overall scheme in terms of education. We're happy to help out in this instance. I think the small number of schools that don't have the numbers there will be rectified in the coming days.
You've introduced these rules and you're blaming the Commonwealth.
I'm not blaming, I've said what I've got to say on this topic, sorry.
How many rats do we currently have in stock, and how?
I haven't got an updated number for you. I think last week I said that there was more than 1.2, of which we'd provided a further 300,000 or dedicated 300,000 to the return to school. I can get an update on that for you. But we are really getting in hundreds of thousands every single day at the moment. We've placed millions, well, tens of millions of purchase. We've placed orders for tens of millions of rat kits. What I can say is the number that we're using in the SA Health provided rat test collection clinics has really dropped off in recent days. That's because we're strongly messaging now that it's much more preferable to have the PCR than the rat. The rat still is not as sensitive as the PCR. It can give a false negative, and that means potentially a delay for people starting their isolation. So my strong message to South Australians who might be close contacts is go and have that PCR test rather than the rat test. The PCR test is readily available. The turnaround time is very low. It's the lowest in the country at the moment. Yesterday we had about 10,000 of those PCR tests which were conducted in the 24 hours to midnight. Can I tell you, we have a capacity of over 20,000 in South Australia. It's the preferable test at the moment.
Premier, we've heard that, just anecdotally, that some people have been turned away from the Mount Barker testing clinic as close contacts and told to get rats, even if they're symptomatic. Would you be concerned if that's true?
Look, I would be concerned about that because our preference at the moment is that the PCR test is the one to have, especially if you've got any symptoms whatsoever. We obviously introduced the ability for people to get the rat test, and that a COVID positive test on the rat would be taken as a positive on the PCR. So we have great confidence that if you pick up a positive on your rat, then it is a genuine COVID positive, but there are many, many false negatives, and so that's why our preference is for obviously to move to the PCR where possible.
We know there's no surveillance at schools besides in childcare centres, so how many rat kits are they being delivered? I understand that was part of the union pulling the pin on the strike was because schools are getting a supply of rats. How many? Can
we provide that detail to you later today? I know that what the program was, but the actual numbers and where they've gone is going to be difficult. And don't forget, some of it is just held centrally. Some will be kept at individual schools, but some of it will be held centrally because if there is an outbreak, there will need to be a surge provided. And we've got plenty. At the last count, we had more than 1 million rat tests in place, but of course we're using a lot per week as well.
You spoke about the number of Indigenous people who now have COVID in South Australia. Are there any communities where there are particular clusters or areas of concern, or is it just sort of spread out across the state, these cases?
No, it is spread out across the state. So you might recall that we were very concerned about some cases on the APY lands. We're particularly concerned about those in very remote places. The situation on the APY lands is exacerbated by the cutting off of the Stewart Highway, but thankfully there, those numbers have been brought under control. We're more concerned at the moment on the west coast, where there have been a higher than usual number reported, but generally right across the state at the moment. As I said, I just checked the numbers again. I think it is, yes, 29 in hospital, 3 in ICU, and as I said, about 1,000 active cases at the moment. So that is above the representation of the Aboriginal community in the overall South Australian population.
Is the government planning to cut nursing shifts in wards as COVID moves past the peak? The Nurses Union claims that there are plans to reduce the number of shifts going forward.
Well, obviously we need to get our resources appropriate with the level of activity, but my very clear point is we've massively increased the number of nurses in South Australia over the course of this government. Last financial year, more than 1,000 additional nurses and doctors, health professionals were put on in South Australia, and at the moment we're in a massive recruitment campaign for nurses. So we'll provide the relevant level of nursing that is required in South Australia. We're very grateful at the moment that we've been able to work with the private hospitals and their nursing employees to particularly help us with vaccination. It's quite possible we'll be able to relinquish some of those staff fairly soon. We are going to be discussing elective surgery again tomorrow at the COVID Ready Committee. So what we've done is, of course, put those bans in place. Now, those bans were put in place to allow us to take beds and ICU capacity, but also some of the personnel. So, for example, the Mile End Clinic has been staffed by nurses from the private sector. It's quite possible we will be closing the Mile End Clinic in the coming weeks. There's just not sufficient demand. At the moment, we have a massive excess demand in terms of the overall provision of vaccination compared massive excess supply in the provision of vaccinations over demand. So we've just got to get that resourcing right. It's far better to get those nurses back out into more important settings, for example, with our elective surgery across South Australia, and to support our more vulnerable communities.
Is SA Health using unpaid students to fill nursing shifts? That's one of the claims the union's made.
Oh, not that I'm aware of, no.
Are there any COVID cases in schools?
Yes.
Are there any COVID cases in schools that you're aware of even before students returned today?
No.
Will you be updating us with the number of teachers that are furloughed, as you have been with SA Health?
Look, we could. I mean, obviously, the number of health staff that are furloughed is probably our critical constraint in South Australia. Look, it's up to the media. I'm happy to provide the update on a daily basis with regards to SA Health, but it is at a much diminished level. If we go back 2 weeks ago, there were more than 1,000 SA Health staff that were furloughed, so they were not available to work. At the moment, it's down to 371. Now, don't forget, we still need to run the COVID response care team, the cricket team, and so a lot of those 371 are actually working, but they're working from home. They might be close contacts of a positive case, but it doesn't mean they can't be working from home to support people living with COVID in the community. We still have approximately 20,000 people in South Australia who are COVID positive. The vast majority of them, I think 99% of those people, are living from home, and so that COVID response care team is critical at being able to provide them with support if they need it.
What do you make of the New South
floods?
Yes.
We understand there's a number of trucks at Kuapidi that are wanting to come south. Are you in communication with the transport companies that are there?
Yeah, so we had the Emergency Management Council meeting this morning. The Chief Officer of the SES, Chris Beattie, is heading up this overall task. The SES is the control agency during this major emergency declaration on extreme rainfall and flooding. We are working with those transport companies. We would like to be able to create safe passage through the centre of Australia. It's not possible at the moment. We have had a special dispensation from the federal regulator to set up an alternative heavy vehicle route from South Australia into the Northern Territory by a reasonably circuitous route through New South Wales, Queensland, and then back into the Northern Territory. Look, I think every single jurisdiction at the moment is doing what we can to respond to the acute situation, which is really cutting off supplies into the Northern Territory. We've also set up a committee in South Australia to look at what the likely effects are of the flood damage to the rail network in terms of supplies coming into South Australia. So whilst it is a long way away from metropolitan Adelaide, it is absolutely critical that we put all resources to responding. We were very concerned with the rains last week. We're particularly concerned now of the forecast for very heavy rainfalls over the next 48, 72 hours in South Australia. This is going to make it very difficult. The Department for Infrastructure and Transport's been up trying to assess the damage just north of Glendambo. Obviously our number one priority is to get the Stewart Highway up and operational again. Again, please, to anybody who thinks they know better, you are just exacerbating the situation. We have plenty of people saying, look, I know how to get through here, and then we've had to effect a rescue and divert finite resources to this. So I'm really grateful for all of our state emergency services and SAPOL personnel who are working on this. I think we've still got a couple of worrying days ahead of us.
What do you make of the New South Wales
route might be available that you're talking about for heavy transport?
No, that's already in place. That's been in place 48 hours ago. So we reported that yesterday at our press conference. So we were able to get that alternative route put in place. But obviously our priority is very much to get the Stewart Highway open again. I can also report, unfortunately, that yesterday we did have to close the Olympic Highway. So a further cut for some of those people wanting to access Olympic Dam.
What do you make of the New South Wales?
Any time scale as to when the highway might be up again?
No, look,
it's
impossible to say because we don't know what the magnitude of these rainfall events are going to be. In fact, in one briefing that I received, it could be up to 200 mils in a single day. Now, you know, to put it into some sort of perspective, I think, you know, Adelaide has a monthly rainfall of about 20 mils some months, certainly around this time of the year. So this is a massive event and it's producing widespread flooding. Look, there is a double-edged sword because for some communities this is very welcome rain. They've been in drought conditions for a very, very long period of time. We have some reports that some farmers are very grateful for that heavy rain, but it is causing major problems with infrastructure, rail and also road, and it's cutting off communities. This is a real concern. We don't put a major emergency declaration in place without an adequate reason. This is of great concern to us. It's something that we're monitoring very closely, and as I said, the Emergency Management Council was set up today. I chair that committee. All the chiefs were in there today to go through it, and we'll probably meet on a regular basis.
What do you make of the New South Wales urging the federal government for more funding?
Well, I note that New South... This is an aeroplane for some people that have missed the aviation industry over the last 2 years. So I note that New South Wales announced their package yesterday. It was a very large number. When we drill down into the details, South Australian small business ended up much better off. I think that the amount that they were capping out at in New South Wales was less than half our maximum here in South Australia. So again, South Australia I think is leading the way in supporting small businesses, particularly over this current Omicron bridge. We've announced Package 7, Package 8, but most importantly what we announced on the weekend was also some real stimulus for demand to get people out and spending again in a safe way. I've been talking for the last sort of 24, 48 hours about the need for South Australians to really get behind some of our sectors which have done it tough over the last 2 years. So now is a good time to safely go out, book a table at your favourite cafe, restaurant, bar or club and go and have a drink. Support those people in the hospitality sector, the arts sector that have been doing it really tough in recent times.
Just to clarify, sorry, actually New South Wales has been asking the Commonwealth for federal funding to help support their package. Would you do the same, or what do you make of that?
Well, I think I've answered that. Our package was far more generous in South Australia. The Commonwealth have been more than generous to the states in terms of their response, in terms of help. There's just no way a state like South Australia could have got through coronavirus without the additional multi-billion-dollar support that the federal government has offered. We didn't ask for additional money on this round. In fact, we provided that money ourselves.
Premier, just quickly, an Infrastructure SA report on public transport in the hills has come out today. It shows, you know, it might cost billions of dollars to put rail in. Do you think there's any viable solution to the issue there of potentially putting rail into the hills? Yeah,
so first of all, can I say that we really welcome Infrastructure SA's report into this. I think this provides a lot more detail for us to analyse. It does say that rail corridor is probably unviable, certainly doesn't produce a commensurate return or return cost-benefit analysis for our state. But what it does do is it highlights some other areas that we can focus on. I'm hopeful that we'll be able to lean into some of those opportunities in the coming days and weeks. I think they've provided us with great food for thought. We know that there's increased traffic going up to the Adelaide Hills. We know that Mount Barker in particular is growing very strongly, and that means that we need to have some alternative solutions. I think the very professional work that Infrastructure SA has done, independent of government, gives us some real options going forward, and I hope to be able to announce something in the coming weeks.
What do you think out of that would be the best solution?
Well, I think probably reading their report, I think the highest value return is around traffic management, and there's some real technology now available in terms of traffic management. The major problem in that corridor is when there is an accident that holds up the traffic there, often for a very unacceptably long period of time. There are some good ways that we can look at looking at traffic management systems and getting them put in place as quickly as possible. There are also some great suggestions on increasing the use of public transport and buses, and some suggestions that have been made to government. We'll look at those over the next 24, 48 hours and come back to us.
Great, thanks everybody.
All right. Yes, I thought it was quite good actually. Yeah, well, it's very professional.
Andrew?
Yeah.
Not all of it needs to be done immediately, so I think...
Clearly you don't go to